My name is Seth Copperdale. I'm the pastor at the Reformed Church of Highland Park, and my wife and I are co-pastors, and we've been here for over 20 years. During the first year of the pandemic, we buried 13 people, which is significantly more people than we bury in an average year. Some of those died of COVID, but all of them died differently. The amount of time that we were spending with people was significantly changed. Dying alone became something that we had to think about for the first time. All of the systems and manners in which we die and the ways we think about death were impacted by COVID. One of the things that we longed for during those first months of the pandemic was a way to positively attack it or positively live into it and say we can overcome this thing. And when we had an opportunity to team up with Be the Change and with Dr. Norma Bowe in creating Global Grace Health, that was an opportunity for the church to see an answer to its prayer. For weeks, people would raise their hands in church and say, God, give us some idea of ways that we might be able to participate in a positive way in a new day, a post-pandemic day. And really, I think Global Grace Health was that answer to prayer.
For over a decade, there's been an organization called Be the Change that's existed in the town where I am a local pastor. I've known that Be the Change is a group that focuses on feeding the homeless throughout central New Jersey, Essex County, all the way down through Middlesex, where I'm located. I've known Be the Change as a group that's concerned about homicides and has frequently decided to start gardens and provide services in communities where there has been violence. When the pandemic broke out, I was glad that a group like Be the Change existed, and I wondered if there might be a way for Be the Change to connect with my nonprofit, the Reformed Church of Highland Park Affordable Housing Corporation, that operates out of the same town where Be the Change was born. Be an opportunity to partner with a new opportunity from the state that would allow us to try to provide vaccinations and COVID-19 education as we moved into 2021. We were thrilled that we applied for funding and we received funding, and we could launch right away into these efforts together, utilizing church spaces as locations for community gatherings where education could take place in safe ways, usually outside of such buildings at that time. We were given sufficient funding to begin planning to help folks with getting to vaccination centers, and then we began dreaming of what it would look like to start our own vaccination clinics. And as soon as it was possible, we teamed up with the Visiting Nurses Association of New Jersey, and together with the VNA, Be the Change, and RCHPAHC, we launched Global Grace Health in a way that allowed us to vaccinate thousands of people. As we moved through the spring of 2021 and saw significant success at reaching vulnerable populations, refugees, immigrants, and the homeless poor, we applied for an extension to our grant funding. And as we got word that we would indeed probably get this funding, we turned our attention to how would it be that we could get to people. At the beginning of the pandemic, people were coming as best they could to get the vaccination. Everybody was, if you remember, standing in lines in large facilities, everyone that is, except those who couldn't get to those facilities and for whom the cost of an Uber ride was simply out of reach in terms of getting a vaccination. We decided to purchase an RV, and we're very thankful that with grant funding, we were able to purchase an RV and be able to bring vaccinations to the people. Throughout the summer of 2021, the RV traveled throughout central New Jersey and occasionally went beyond our region to hit places far north and far south. The key was to get to places like the back door of a frozen food warehouse or the back door of any place where we would find a group of workers breaking up cardboard boxes and taking out the trash, asking who it was that needed to get a vaccination. Frequently, we found that not only the workers themselves, but their families as well, who were frequently providing home health and other things throughout the week and couldn't get to those vaccination clinics, needed the vaccine as well. So we began to take the RV not just to the backs of businesses, but also to the homes of individuals who would say, please come to Lakewood and bring a vaccine to my spouse.
everyone. I'm Dr. Norma Bowe. I'm a professor at Kane University in Union, New Jersey, and I've been teaching a long time, but my background is nursing. And so when this COVID pandemic hit us, we scrambled to try to get supplies to everyone we could possibly affect. And we started an emergency food pantry so that people with COVID or who were exposed to COVID wouldn't have to go to the grocery store. We found many people were food insecure. So many people lost their jobs. Everyone had needs. It was a really extraordinary time. Now, once the vaccines came, I started to feel a little less helpless. I knew that as a nurse I could be a vaccinator. I became a Medical Reserve Corps member, and I was trained to do the vaccines. And then, with the help of the Center for Disease Control, the New Jersey Department of Health, and particularly the epidemiologic laboratory capacity, we were able to apply for grant funds to create a mobile vaccine unit. And not only do we do vaccines, but we also do health screenings. And so to be in the community, to hear people's stories, to be able to give access to vaccines where some people just didn't have access. They didn't have a car to drive to a clinic. They didn't have, there were language barriers, transportation barriers. There were some folks who didn't have paperwork. All of these people deserve vaccines. We have vaccinated the chronically and persistently mentally ill, the very elderly. We have been in the field at homebound folks who are too sick to come out to a vaccine clinic. And we have heard incredible stories from people. Folks who have lost loved ones to COVID. People who wish that the vaccine had been available for their loved ones. We have folks who are from other countries where vaccines are not readily available. And so we have really loved being able to be a stable community unit and bring all of this out to people who, are our neighbors. I know that I have started to collect these stories. They impact me a great deal. I'm a mother of 2 daughters who mean the world to me. And if something were to happen to them that could be avoided, I don't even know how I would feel. So being able to get out and help other family members who have also lost people has been a great pleasure of mine. And I know that for the rest of my life, I will remember these faces, these names, this tapestry of people who have come together not only to do the work, but the people who we have been able to help and vaccinate and give food to. I will always be thinking about the juxtaposition between health and healing. And this has just been extraordinary. We have an amazing team. I'm incredibly proud of them. They have all risen to the occasion, and they do exceptional work.
As is the case when providing anything to folks who are vulnerable, it's not just one thing that people need. One of the beauties of Global Grace Health and Be the Change being all mixed up into one shared venture here has been that all of the work that Be the Change has done over the years in terms of food distribution and knowing where to get large boxes of food and all of those other factors that are part of a full human life have been incorporated into Global Grace Health and into the RV project. So now it's been easier for Be the Change to get food to the places where it wants to go, both through the RV and through using various trucks, sometimes of the Housing Corporation, sometimes from other organizations, just to make sure that the people we reach with vaccines are also reached with protein and caloric intake.
What I like about being a community health worker is that I get to work with the community. We don't just do vaccines, but we also do food distributions, and we're sending stuff over to the Poland for Ukrainian efforts right now. So one of the things that I really like about my job is that I get to work with some of the best people I've ever met.
I have a 2-year-old son who was born February 10th, 2020. This is one of the best jobs I ever had. Putting a smile on other people's face makes me happy.
Something great about being a community health worker is we do vaccine clinics, we help the homeless, we do food deliveries. Every Thursday we get food from Morristown. We go deliver it to families in need. Well, I'm also a Kane student. My major is biology. I want to go to school to be a doctor. Wonderful team that I work with. I'm glad to have met them. They're such wonderful people. We work together as a team. We come together with our ideas. We make it to fruition.
When we talk of Global Grace Health doing all these wonderful things, what we're really saying is that community health workers are doing all these wonderful things. Community health workers coupled with volunteers and community members. Community health workers, one of the beauties of what they're doing is they're not only generating information and education for, I'll call them clients, they're also generating leadership throughout the community. So whenever we had a vaccination clinic, it wasn't just 6 community health workers running that clinic. It was 6 community health workers, and in addition, sometimes 15 or 20 volunteers from the Mexican community, or the Honduran community, or the Guatemalan community. When we were handing out flyers at a mosque, we were, being assisted and motivated by Arabic speakers and Dari and Pashto speakers. It's just been incredible to see what community health workers can do, not only in terms of reaching people for services, but reaching people for leadership.
I'm a community health worker. What I like about my job is we do vaccine clinics. We feed the homeless. When I lost my sister, she had a sickle cell disease. I changed my major. I was a history major. Public health.
My journey to becoming a community health worker, actually am a returning citizen. I was formerly incarcerated, and the reason I want to emphasize this point is because it played a large role, probably plays the largest role in why I try to immerse myself as much as possible in efforts to give back to the community in any way possible.
My name is Fran McCluskey, and I work with the Visiting Nurse Association of Central Jersey along with our team here, Rita Jacoby and Jacob Sadler, and we're here today working with Norma's team, Dr. Norma Bowe and her team Be the Change. We're so happy to work with them because we travel all over New Jersey working with the COVID vaccine clinics, and they're an integral part of us working together and getting enough people vaccinated, and that's the point why we're here today as well at the Piscataway YMCA. And our team here is Jacob and Rita, and they're a big part of our team as well. Our nursing staff, as well as our computer staff that handles all the administrative end to get all our information to the New Jersey immunization records.
Here are some of my vaccine stories. She wept after her second shot. Her mother died from COVID just months ago in Peru. Vaccines are not widely available there. The hospital in Peru did not have the capacity to allow her a last goodbye. Her mother was only 58 years old, so she weeps through her second dose of Moderna. She says she feels lost. I think about all of the lost because of this virus. Vaccine story. They come together and sit in both chairs. She is scared. He has questions, so many questions. They explain that they are chronically and persistently mentally ill. They tell me all of their medications. I listen patiently and let them know that the vaccine won't interfere with their meds. She shows me her inhaler. He says he is worried for her. They hold hands for the shots. Afterwards, she cries. She is inconsolable. I ask her if she is okay. She says she is crying because I am nice. They say that no one is ever nice to them. Ever. No one. He sits in the chair His sister talked him into this appointment. He wants the vaccine in his right arm, even though it's his dominant hand. I ask him why. He says he hasn't had health insurance in years and can't afford his blood pressure medication. He says his blood pressure is high. He wants the shot in his right arm so that if he has pain in the left, he will know he is having a heart attack. And he had COVID in the fall. The chills were unbearable. He couldn't breathe. He didn't eat or sleep. Nothing stayed down. It went on like this for 9 days. I ask if he went to the hospital. No, he says. He has no insurance and is afraid of ice. My body hurts. I'm tired. I leave the clinic after a long day and turn my face up to the sun. I take a deep breath of the warm air and marvel how it's turned from winter to spring while I was in there vaccinating today. It's kind of a miracle, right? The air smells like hope.
It's just really important that we thank the New Jersey Department of Health and the Center for Disease Control for the wisdom that they've shown through this pandemic. So many things have been out of control and so much has felt like there hasn't been clarity, and yet the clarity that came from the Department of Health to come up with the ELC grant that recognized that already existing nonprofits that have tentacles in the community, nonprofits that understand faith communities, that understand social justice organizations, that understand the movement of students, that understand the power of the homeless to help themselves. All of these things, it just really worked together. So we hope and pray that there's never a pandemic again, but I feel more prepared for whatever comes next because of the wisdom of people helping people. Be the Change, Global Grace Health, these things are a huge part of the greater work that's been enabled by the Department of Health. And we're thankful that it's happened here, but we also know that other great programs have happened around the state. All of them together are part of what are going to help us get through this time and make us prepared for future times.